On this Thursday night, Toronto's mayor makes a pandemic plea.
Stay home.
New dire projections for what's coming in Ontario and new restrictions in Alberta, but not the circuit breaker doctors pleaded for. Should Ottawa invoke its emergency powers? The push?
Wake up, young Trudeau.
And the push back.
We don't need the nanny state telling us what to do.
A cautionary tale from Italy. Hospital emergency rooms are overflowing again. Could this be coming to Canada? And an Ontario First Nations water crisis.
And look at all the sludge in here.
New promises to clean up the problem met with long-standing skepticism.
Global National with Donna Friesen.
Good evening and thanks for joining us. There is no good news tonight about how the bulk of this country is handling the second wave of COVID-19. Many hotspots, with the exception of the Atlantic bubble and the North, are confronting a situation that is worse than the first wave. Nothing about the virus has changed from the spring. We know the best way to stop its spread right now is to stop people from coming into contact with each other. Here's the overall picture. More than 4,900 new cases have been confirmed in Canada today. More than 80 more people have died. Apart from Atlantic Canada, which has sealed itself off, and the territories, case numbers are surging. Both British Columbia and Ontario broke daily case records today. In Manitoba, the worst per capita in the country, there were more than 470 new cases. In Alberta tonight, Premier Jason Kenney is back in self-isolation after coming into contact with someone who has COVID-19. Case numbers there are surging. The number of Albertans hospitalized with COVID-19 has hit a record high. There are now 51 people in intensive care, up from 30 a little more than a week ago. More than 400 doctors have pleaded with Kenney to impose circuit breaker restrictions to stop the spread. Today, he didn't do that. No businesses have been told to shut their doors, but bars and restaurants must close by 11 p.m.
This two-week push is, I believe, our last chance to avoid more restrictive measures that I and most Albertans desperately want to avoid.
As Heather Yourex-West explains, there are fears without tougher restrictions now, the health system could soon be in crisis.
After a summer of relative calm, doctors within Alberta's health system are preparing for a battle. For weeks, the number of daily infections has been rising, and now many of the patients are in need of hospital care.
I think everybody knows what's going to happen within the hospitals. Everyone is scared of what's going to happen.
The escalation in the last week alone has been startling. Between November 4th and 11th, there were more than 5,000 new infections, 53 new hospitalizations, and 16 additional patients sent to the ICU.
It's likely that in 10 days' time, that will be maybe not quite doubled, but supposing we have 80 patients in the ICU system will collapse.
We are at a dangerous juncture in our province.
Alberta's premier, who is again isolating after being exposed to COVID-19, agrees the situation is serious, but believes targeted measures will be enough to bend the curve down.
We think it's necessary at this time to bring in limited, focused, targeted measures that reduces opportunities for viral spread without imposing significant broader negative impacts on our society, on lives and livelihoods.
Emergency room doctor Joe Vipon fears the measures will not be enough.
Really, I don't think the government has quite grasped the seriousness of where we're at and the depth of what we need to do in order to get out of this.
Dr. Vipon is among more than 400 Alberta physicians calling for a short, sharp period of lockdown. How long may depend on how bad the problem is allowed to get.
The idea that Alberta can take a 2-week timeout and hey presto, COVID will be under control is foolhardy. You're going to have to take 2 months, not 2 weeks, because you have climbed the mountain so high that it takes that amount of time to reach the bottom on the other side.
Because the people in hospital now were infected weeks ago, so we don't yet know how serious the situation in Alberta truly is. Heather Yourex-West, Global News, Calgary.
In Canada's biggest city, community spread is out of control. Toronto has record levels of COVID-19 now, and today the city's mayor had a blunt message for people.
Stay home. Stay home. work from home, study from home. Don't go out except to shop once a week by yourself. Don't go out to do anything unnecessary.
Ontario's Premier, though, has resisted reimposing tough restrictions. New modelling released today shows that province is headed down a dangerous path. The new projections predict, given how fast the virus is spreading, Ontario could have 6,500 cases per day by mid-December. And under every scenario in those models, the province's ICU capacity is expected to be threatened within just 2 weeks. The projections are dire, and yet Ontario's Premier says the economic risks of another lockdown are too great. Eric Sorensen reports.
2 mid-October weddings here were linked weeks later to around 50 confirmed cases of COVID-19. But it's not just big events in hot zones like the Greater Toronto Area. Many Ontario health regions are counting more COVID cases. The pandemic is worsening. In the weeks ahead, a projected 5% rate of COVID growth in Ontario would likely exceed the rate in some European countries that are already in some form of lockdown. New Ontario modelling shows hospitalizations in gold have risen 61% in the last 3 weeks. Patients in ICU beds have almost reached 100. The province projects ICU occupancy will exceed 150 beds within 2 weeks. In a worst-case scenario, it would exceed 400 beds in 6 weeks' time, seriously straining Ontario's capacity to care for acutely ill COVID patients.
Those projections, as you said, are alarming. You need to return to what we did during the first wave. You need to return to that household limitation.
A group of Ontario doctors says this province must do more now to flatten the curve.
We're recommending that people stop all non-essential services, including public events, of course, so that we can gain control of the spread while we strengthen public health measures.
Ontario's opposition leader called for a 2-week circuit breaker for hotspots like Toronto, a brief but thorough lockdown to stop the spread. But Ontario's Premier says he has to balance the health of Ontarians and the economy. He does not want a lockdown.
How can you measure the depression, the mental health of businesses and the owners when all of a sudden they go belly up? There has to be a balance. Priority, number one, on health and safety, but very close beside it is the economy.
Ontario prepared to open more widely this weekend, but Toronto said no to reopening indoor dining. It's led to mixed messaging. The Premier wants the economy open, while Toronto's mayor says this.
Please stay home as much as you can. If you have any doubt about whether you really need to go somewhere or not, don't go. Stay home.
It's a hard needle to thread. How to patronize businesses to keep the economy afloat while being urged to stay home. Eric Sorensen, Global News, Toronto.
BC updated its COVID-19 modelling today, too. It is projecting new cases could double in the next 13 days unless people reduce who they come into contact with. Hospitalization numbers in BC are already above the peak they were this spring. And BC's provincial health officer says the majority of new cases can be traced to household gatherings and community interaction.
We started to see young people again driving infection in the province, whether it's through social interactions primarily, whether it's through work interactions. And what we're seeing now is spillover into older age groups where people are more vulnerable.
Manitobans are living under the tightest restrictions they've faced since the pandemic began. The entire province is in the critical red zone now. The test positivity rate in Winnipeg is 11.4%. That is the worst in the country. And the message there, too, is stay home.
If we follow these orders, don't try to find ways around them, don't try to find ways that Manitobans can gather, we'll start to see these numbers come down as we did before.
Under the new restrictions, Manitoba schools will remain open, but most non-essential retail stores, gyms, hair salons, and houses of worship are closed, and people are being urged to avoid all non-essential travel. The provinces have been calling for more federal financial support, and there's some pressure on the Prime Minister to take action and invoke federal emergency legislation, but that is a step too far for premiers like Ontario's Doug Ford. David Akin explains.
It's concerning, it's alarming, and we have to stay on high alert.
But are those alarming spikes coming from schools, from restaurants, gyms? The science on that is evolving.
It's a complicated question, and data is complicated.
But scientists are crystal clear on this.
We know that COVID spreads in the following conditions. A bunch of people together, shared airspace, limited ventilation, no masks. All we need to do is make those situations stop.
But who will make it stop? Some say now is the time for the Prime Minister to step up.
His dad used emergency powers for inflation, but he won't do it for a pandemic. Wake up, young Trudeau. You have an emergency and you need to use emergency powers.
But the man himself disagrees.
I don't see it as being necessary right now.
And if he did, the Prime Minister would get grief from the premiers.
That wouldn't go over too well, not just with me, with all 12 other premiers.
The more common view among public health experts is that local health authorities should prevail.
Who do we listen to? I think really we should be listening to our local municipalities that know what's happening, know what the rates are.
But there is still plenty for Ottawa to do. For example, Health Canada could respond more rapidly to evolving technology such as home testing kits.
If we could have an approved home testing kit for COVID that we could use as a screening tool, that we could actually bring this pandemic to an end.
Now, the Prime Minister and the Premiers met by teleconference today, but they were not expected to talk about an expanded role for Ottawa. But the Premiers were expected to ask the PM yet again for more cash to fight the coronavirus. Donna?
All right, David Akin in Ottawa, thank you. In the U.S., the pandemic is now worse than it has ever been. Almost every metric is trending in the wrong direction, and records are being broken every day in nearly every American state. More than 143,000 new infections were recorded across the U.S. on Wednesday. That is the highest single-day tally. More than 65,000 Americans are in the hospital. That's more than at any time since the pandemic began. Hospitals are running out of beds. New Jersey's governor is pleading with people to choose inconvenience over death. Jackson Prosco on America's surging second wave.
In El Paso, Texas, they've brought in a fourth mobile morgue as the death rate soars. In Wisconsin, hospitals have reached capacity. In Ohio, which reported 7,000 new cases Thursday, the governor warned businesses may soon be forced to close.
It's advancing quickly and seeking victims in every community in Ohio.
Yet as the virus spreads like wildfire, the White House is silent. The coronavirus task force has effectively gone dark.
There's a viral killer going on in each of our communities. If it were an army with guns, you can be sure we would be focused on it. Why aren't we focused on this virus?
Instead, in the final 69 days of his presidency, Donald Trump is blocking President-elect Joe Biden from accessing key government health agencies and data as part of his refusal to concede.
Candidly, the president and his closest advisors, when they're not actively being infected or infecting others with the coronavirus, have been doing nothing.
At current rates, the U.S. is on track to record another 150,000 deaths before Biden's inauguration in late January. Without access to government data, medical experts warn the Biden administration will be left playing catch-up on day one, despite assembling a panel of experts in advance.
They are going to have plans, they're going to have strategies, but without understanding the current status of what's happening inside the agencies, they're going to have to be doing it flying blind.
It's clear the promise of a vaccine in 2021 won't be enough to get the U.S. through the difficult months ahead. New York is approaching its self-imposed threshold for shutting schools down again, and Chicago issued a renewed stay-at-home advisory, while Americans face the prospect of explosive case growth as millions prepare to travel and gather for the busy Thanksgiving holiday. Jackson Prosco, Global News, Washington.
The second wave hits Italy hard. Coming up, the overwhelmed hospitals and the building frustration. At the start of the pandemic, we all watched with horror what was happening in Italy and hoped it wouldn't happen here. Well, now Italy is fully engulfed in a second wave. In the last 24 hours, nearly 38,000 people have tested positive and more than 600 people have died. Hospitals are overwhelmed again, and it's a cautionary tale for all of us. Crystal Gamansing reports.
At this hospital in Naples, it's curbside care. For at least 4 days, staff have been treating patients in their cars, checking blood pressure, even administering oxygen. And it's not the only hospital in southwestern Italy making headlines. A video spreading on social media appears to show a corpse on the floor of a bathroom. The Director General of the Cardarelli Hospital says an investigation is underway into the death.
La cosa, diciamo, più deplorevole.
It's correct, he says, that people know of certain things, but what is deplorable is the way in which the communication was given. Naples and the entire Calabria region is struggling to cope with rising COVID-19 cases. More than 4,000 people there tested positive in the past 24 hours, yet it is listed as yellow on the country's tiered system of restrictions. 5 Italian medical organizations signed a letter warning of the dire situation playing out, saying hospitals are now close to collapse. Adding a probable, if not certain, consequence will be the inability to guarantee quality standards for care for all chronically ill and non-COVID acute patients. Italian Prime Minister Giuseppe Conte has resisted imposing another national lockdown. Speaking at a summit for world leaders, it doesn't appear he'll be changing course.
We needed to look beyond the emergency and focus our global action on fostering an inclusive, sustainable and resilient recovery.
Accettato perché era grave. A sustainable and resilient recovery means little to this woman. Her father died after testing positive for COVID-19, and she's angry because he wasn't admitted to hospital right away. Doctors warn of an additional 10,000 deaths in a month's time if the government doesn't introduce more restrictions. Crystal Gamansing, Global News, London.
In New Zealand, a mysterious case of COVID-19 is being investigated. An Auckland woman tested positive for the virus, but officials aren't sure how she got it. She's a university student. She lives beside a hotel where people arriving from abroad are being quarantined. Health officials are trying to work out if there is a connection. People who work in central Auckland have been told to stay home until the cause of transmission is determined. Still ahead, Ottawa answers building demands to probe contractors working on a First Nations water crisis.
You're watching Global National.
Promises are being made again to fix the water crisis on a remote Northern Ontario First Nation. People living on the Neshtanaga First Nation have had to boil their drinking water for 25 years now. Last month, things got even worse. An oily substance was found in the water supply and the community was evacuated. The federal government says a fix is coming, but as Mike LeCouture explains, the chief isn't buying it.
And look at all the sludge in here.
That sludge and sheen on the water are why most people from the Neshtanaga First Nation had to be flown out of the territory weeks ago. Derek Munoz is one of the few left behind. He goes house to house, making sure sewers don't back up more than they already have.
It's just, daily routines. 3 times a day I check certain houses. Yeah. And it takes a lot out of me to try to clean that.
He does it to help his community, a community that has been without clean drinking water for 25 years. Things reached a breaking point last month when an oily sheen was spotted in the water reservoir. But now it seems the federal government has a solution. In a letter to Neshtanaga First Nation Chief Chris Munoz dated November 6th, Indigenous Services Minister Mark Miller said, quote, "Clean drinking water should be available in your community by December 11th, 2020. But the chief isn't buying it.
I was just given a report yesterday that repatriation will not happen until December 2. So I don't think that's going to meet the timelines that Minister Miller has indicated.
Munoz says when his people return home, they worry the water can only be used for things like flushing toilets and washing clothes. NDP MP Charlie Angus worries this will only be a temporary fix because the infrastructure needs a massive makeover.
It's like they're claiming they're going to put a new engine into a rotted old vehicle and then think that the vehicle is going to run the pipes, the sewage systems. They are all completely out of date.
Chief Munoz claims the tendering process is flawed and that major pipe problems were never fixed. It's why he demanded an investigation of the business practices of companies that worked on their water treatment plant, something the Liberal government has also agreed to. and the chief hopes it will mean an end to the boil water advisory that started in 1995.
25 years, 26 years is dehumanizing. Are we not human? Are we not important?
Mike LeCouture, Global News.
The bot who cried wolf next, a high-tech bear repellent. Quite an unveiling in Turkmenistan this week. A statue of a big golden dog has been given a prime location in the capital city of the former Soviet Republic. It is the pet project of the president of Turkmenistan, who loves this particular breed, the Central Asian Shepherd. So much, in fact, he's written a book about them. And he gave a puppy to the Russian president, Vladimir Putin. He also apparently oversaw construction of this statue. It's 15 meters high. It has a screen showing videos of the breed. Meanwhile, much of the country lives in poverty. And in Japan, look at this. This statue moves and growls. It's a robot wolf, and it's designed to scare away bears. It's called Monster Wolf, and when its motion detectors are activated, it moves its head, flashes lights, and emits 60 different sounds, apparently, including wolfish howling. And apparently it works. Bear sightings are at a 5-year high, mostly in rural areas in western and northern Japan. There you go. That is Global National for this Thursday. I'm Donna Friesen. Sticking with the animal theme, tonight's Your Canada is this real live moose in Jasper, Alberta. We'd love to see your Canada. Please send it to viewers@globalnational.com. Thanks for watching. Robin Gill will be here tomorrow, and I'll see you on Saturday at 7 for the new reality. Take care of yourselves. Bye-bye.